I am Dr. Lisa Fillis. I am a naturopathic doctor here at Bixby Wellness. I've been in practice for about 20 years. Oh, thank you. I'll start over. No, I'm Dr. Lisa Fillis. I'm a naturopath here at Bixby Wellness. So we are talking about menopause today. That's me. All right, so this is just kind of defining some of the terms that we use in medicine. Premenopause is basically from the time you start your period to about age 40. Perimenopause is that 5 or so years before you actually stop your period. And menopause, we look backwards and we go, okay, you haven't had a period in 12 months, you're officially in menopause. However, this is all, there's so much overlap that in real life, nobody cares about these terms. This is just, okay, where you are in your life. So when we're talking about our normal, quote unquote, normal cycle in our 20s and 30s, when we start our period, on the first day, we have no hormone. Then as we go through our weeks, estrogen climbs, and then we ovulate, and it kind of drops a little bit, and then it gives a little spike, and then comes down again. Progesterone, the green line, we don't have any progesterone at the first couple weeks of our cycle. Then we ovulate, it comes up, and we have a huge spike second half of our cycle, and then it comes down again. If we are not pregnant, this drop in hormones still signals for us to have our period. So this is a normal, quote unquote, normal cycle. Testosterone pretty much stays the same through this time. And it's very common for our numbers to get up, 200 or 300 with our estrogen. I bring that up because when we're testing hormones in the future, we kind of want to know where we are. So this is when we are having our cycles, 20s, 30s, it's pretty rhythmic. It's consistent. Even if you're not perfect, it's consistent. Then we hit perimenopause, and it is, excuse my language, a shit show. It's all over the place. Here, there, sideways, backwards, it is all over the place. And then we go through menopause, we have no hormones, and it's literally a flat line. So I look at this as a visual representation of my patients going, I feel like crap. And I'm like, well, of course you do. It's all over the place, and then you have nothing. So you're not crazy. Oh, let me come back to this. Okay, so 3 things I want you guys to know. You are not alone. You look around this room, there's 25 women in here. We had a panel earlier, there is 12 women in here. So you are not alone going through this process. And you don't have to suffer. There are 6 of us up here. You've got your doctor, you've got your therapist, you've got your priest. You're not alone. You don't have to suffer through this. And hot flashes are not the only symptom. You go to your doctor and you say, I have hot flashes. Okay, but what if you don't have hot flashes? What if you have brain fog? What if you can't sleep? What if you've got aches and pains, right? So there's a lot of things going on. I found this earlier this week. I thought it was very funny. Remember that time I thought I had diabetes, a brain tumor, Lyme disease, or a blood clot, but I was really just going through perimenopause. All right, so menopause is not a disease. It just feels like one. We're all going through menopause. Every woman in here is going to stop having a period. This is a normal process. However, it can be really, really difficult. As you can see from those slides, your hormones are all over the place. So what we're trying to do is make this transition as easy as possible. So we can do hormones. There's a lot of herbs that can be helpful to this process. We certainly want to look at stress. So stress is another player in this. Even though we're talking about hormones, stress is another major hormone that we use, or that we look at, because it plays a big role here. This is kind of hard to see, but everything comes from cholesterol. Cholesterol makes our hormones: progesterone, cortisol, DHEA, testosterone, estrogen. The reason I bring that up is when we're going through our cycle, if we have a lot of stress and we're producing a lot of cortisol, it is going to steal from progesterone. It's fine. You got a week of a stress, right? You're going, you're going on a trip, whatever. Okay, you lose a little bit of progesterone, no big deal. But if you've got months and months, years of stress, all that extra cortisol pulls from the progesterone. And we go back here a little bit, we can see this. You're supposed to have a lot of progesterone here. If it's slowly decreasing, this is even in your 40s, it's decreasing. Then when you start to have your cycles, you're having more and more and more symptoms. And when you go through menopause, your ovaries stop producing your hormones, and your adrenals take over. Adrenals is the hormone, the gland that produces cortisol. So if you are going through menopause, your ovaries are stopping, and now your adrenals are trying to take over, but you've had years of stress, your adrenals are just tired, and then we have a lot of symptoms from not having enough hormone. So we definitely want to look at stress. Okay, let's talk about the elephant in the room, about cancer. Bioidentical hormone replacement does not create cancer. There's a study 20 years ago that was looking at women's hormones, women's health, and they stopped it prematurely in 2002 because they were saying, oh, hormone replacement gives you cancer. So for 20 years, the collective mindset was, oh, don't take hormones, you're going to get cancer. Well, now they've gone back, thank God, and realized that the problem was the synthetic progestogen. It wasn't even the synthetic estrogen, it was the synthetic progestogen that was causing the problems. And now we realize estrogen is actually protective. So now finally the medical world is going, okay, we need to actually have some hormone. So there are certain cases, of course, that we're not going to do hormones if you already have had a history maybe of breast cancer, but for the most part, this is not a problem. To me, the bigger problem is we've got collective thinking that, oh my gosh, we're going to have cancer. Invariably, a woman will come in, I've got issues, I don't want to get cancer, I don't want to get cancer. You're not going to get cancer. And now we have this huge gap of a generation who didn't get help because they suffered needlessly, and they didn't get help because, oh my gosh, you're going to get cancer. So I just like to, talk through that. Okay, so what can we do? Obviously, I'm a naturopathic doctor. I'm my daughter too, but so I do hormones, but it's also about stress and sleep and nutrition. So we're looking at everything, right? Yeah, we might do hormones, but we'll probably be able to talk about maybe some herbs to help you sleep, or maybe we'll do. You need to get some exercise. Maybe we'll start looking at your stress hormones. Estrogen. Every cell in the body loves estrogen, so we need estrogen for our brain, for our heart, for our bones. So I'm not always going to push hormones on you, but that is certainly something we will talk about. You may come in, if you come to see me, and decide, I don't want to do hormones, but I'm definitely suffering. So we maybe talk about herbs, maca, St. John's wort, black cohosh, all very helpful. So big picture, we're trying to have healthy aging. Okay, I went through that a lot faster than this time. The point is, there's help. Does anybody have any questions? Did I miss anything on my list? Thank you. Put my glasses on. Oops. No, I got it. Thanks. Oh, I did. Thank you. I wanted to show a case where this is a current patient. She's 47. She's still having her period. Her estrogen is 38. Now, it's maybe hard to see, but she should be 100, 150. There's a little bit. If you look here at postmenopausal is 54. So she has even fallen down lower than the postmenopausal range. But she's still having her period, so her doctor's like, well, we're not going to do anything. We have to wait, right? She's suffering for no reason. So I just bring that up because it's really important to find somebody who is willing to look at the big picture of what's going on for you. So, okay, I think I said everything. Yes?
I'm just curious, how do you do this type of testing?
So I will use blood tests. This is a blood test. I'll use saliva testing. I'll use urine testing. It kind of depends on the individual person. Typically, blood work is covered by your insurance. We like that. Saliva test and urine is a little bit more thorough. So if there's other issues, let's say you're having trouble clearing your estrogens, I might run a saliva test or a urine test because it gives you a better idea of how your body's metabolizing it. For the bare bones of what's going on in your body, this is a really good tool with blood. And it's easy, right? A poke and you're done. Yeah. Yes?
Going back to that, I've heard that test you have to be on your period.
There's a certain time of the month. So if we go back to where we here, if we test your hormones the first week or so of your cycle, it's not going to be helpful because progesterone is naturally low. So if we test it then, it's not going to be that helpful. So we like to test it between day 18 and 21. We know progesterone is supposed to be really high, and we know estrogen is a decent height. So we typically test at that point.
But if you don't, what if you
don't? Oh, if you don't have a period.
Yeah.
Right. So now you've already passed over. Right. So if you are already postmenopausal, you got nothing. Okay.
Like every other month.
Oh, okay.
Exactly.
Right. So if it's all over the place, we kind of guess. I don't mean to guess like, oh, we're just guessing, but we go, okay, where do we think we are in your cycle? So let's say you haven't had a period in 2 months. Sometimes you feel like, oh, it's coming. If you don't, we just go, okay, let's test it today. What's going on? And with the idea that it's all over the place, right? It is literally, today is this way, next month it may be completely different. So this is a hard time to test, but it gives us some good information. If you test really high, okay, we probably wouldn't put you on estrogen that day, but we might give you some progesterone to help to balance that out. So does that make sense to answer your question? Okay.
what role do symptoms play?
Symptoms are everything. Well, symptoms are everything,
Right.
but the blood work can be helpful to define where we go with that. Yes.
Does birth control impact the estrogen?
It does. So if you are, and it depends on which, if you're on an estrogen or a progesterone-based hormone, that might affect what we do. So sometimes we will have you go off the birth control if it's tolerable, if we really think we need to get an accurate reading. If you are on birth control and you're starting to have symptoms, then we might just base it on your symptoms and not do any blood work because that won't be as helpful. We've been doing hormone work for years without always doing blood work, right? This is a great tool, but it doesn't have to define everything. Yeah. Yes.
I have read that you should take progesterone if you're taking estrogen.
Correct.
But if you don't have uterus anymore, can you take this?
Correct. When they do research, you don't need progesterone if you don't have a uterus. However, progesterone can be very helpful if you're having sleep issues. So even if you don't have a uterus, we still might do some progesterone just because it helps with sleep. Yeah. Yes.
So what if you don't have your period anymore?
So you've already gone through menopause. If you haven't had a period in a while, I probably wouldn't do blood work. I'd probably just say, let's get you on some hormones or let's get you on some support and start to treat your symptoms. Yeah. Yes.
Do you recommend us keeping a journal of where we are and symptoms along the way?
It is very helpful, especially if you're in this transitional period of it is all over the place, because each month can be different. It's crazy making, as we're all here realizing. It's crazy making. One month you feel great, the next month you want to kill somebody, the next month you're crying, the next month you're running a marathon. It is literally all over the place. So if we're trying to figure out, are your symptoms related to hormones, having that diary of some sort is very helpful. Yeah. Yes.
What if you've had a hysterectomy like a long time
Mhm.
ago, or a partial hysterectomy?
Yep.
You don't have your period. I haven't had it for a while.
Right.
So how would you know where you're at?
All right. Well, you still have your ovaries because you only had a partial, so your body is still cycling. There's nothing to bleed out, right? So a lot of times when you still have your ovaries, because you know your body better than anybody. Oh, I should be getting my period. You start to have breast tenderness or irritability, and then a couple of days later it passes. Oh, okay, I had my period. So that's one way of saying, okay, you're still having it, or I haven't had any symptoms for years, and now I'm dry, I'm moody, I can't think. Then we would really want to look at putting you on some hormones. Yeah. Yes.
So thinking of someone who has their period, they can essentially take their temperature to identify when ovulation is.
Mhm.
Would that give you any insight during perimenopause and kind of like?
Not necessarily, because sometimes you're not even ovulating. In this time, it is such a crapshoot. You're not even ovulating. So if you feel like, oh yeah, I think I'm ovulating, that would only be helpful to know maybe when we start the progesterone, because typically we're only doing progesterone dosing the second half of your cycle. So that might be helpful there. But if you're a couple years away from menopause, you may not even be ovulating anymore, or you may only ovulate 3 times a year. Yeah. Any other questions? Yes. Oh, sorry.
How do you know which hormone would be best for you? If it's more progesterone, estrogen, or is there like a mix? Or how do you know what's best for your body?
Right. So we as women, we're mostly estrogen, progesterone. We have a little testosterone, and we can maybe talk about testosterone in a minute, but most of our symptoms come from that decrease in estrogen. Estrogen is anti-aging. Our bodies love estrogen. Every cell responds to estrogen. So most of the symptoms that we're having, hot flashes, mood swings, dry everything hurts, is because your estrogen is just dropping so much. So that's typically where you're going to feel better, is when we replace the estrogen. Unless you don't have a uterus, we're also going to give you progesterone too, so it's helping to protect. But if we're thinking that stress is a major player here, then we may focus a little bit more for someone like that on more progesterone. Or if you're having terrible sleep issues, progesterone can be really helpful for sleep. So we might focus a little bit more on that. But typically we give both. And I didn't talk about, you're right, I didn't talk about something. Bioidentical. So I talk about bioidentical hormones. That means the estrogen we give you looks exactly like what our body produces. You can get Premarin, which maybe some of you may know, it's horse urine. That's what they've been giving women for years, is what that women's health study was on. That's not bioidentical. It comes from a horse. there's birth control. It's still an estrogen, but it is not bioidentical. It doesn't look exactly like what we produce, so there's a little bit more symptoms. So we use what we consider bioidentical. It looks exactly like what our body produces because we know it's healthy. Yes.
When it comes to mood swings,
Mhm.
I recently had an episode of being so hormonal, like it reminded me of when I was pregnant with
Mhm.
my kids.
Yeah.
Getting so maybe I was very angry and could have lashed out, and a bomb could have went
Yes.
off.
Yes.
I'll put it. But I vented and I diffused the bomb.
Okay,
It took
good.
3 days.
Right. Right.
But I said, oh my gosh, why was I so wound up? And then my period started like
Right.
a second later.
Right.
So I knew it was hormones
Right.
raging.
Yes. Yes.
How do I control that, or what can I do in the meantime so I
Right.
don't hurt anyone?
Right. We'll get you a bubble around you. Yes. So, are you still having cycles?
Yes.
Okay.
But I just had my first like weirdness. Like I
Mhm.
think I missed one,
Right.
and then it was there and gone and came back, and
Right.
I'm in the middle zone.
Okay, great. So there's an herb called maca, specifically a company called Feminescence. And the reason I bring that up is they've done numerous studies on the different strains of maca, and they can give you their website has all these studies. So I like that. Maca is really good at helping to balance this. For you, because you just started the weirdness, you may not be something we want to throw hormones at, right? Maybe we just want to use lifestyle, nutrition to kind of balance that. So we might do something like maca. There's a number of herbs. Dr. Long is going to talk about some Chinese herbs. Dr. Sarah is going to talk about some mental health stuff. But there's answers. So probably the best bet was to get one of us or talk to your doctor and go, here's where I'm at. What can I do? Because there's an answer for you. There's an answer for everybody in here. Yeah, but I like maca for that. All right, all good? All right.